Okay, so now it's time to put this into practice and demonstrate how this new approach and the extrication decision tool should be used out there at the roadside. First up, we're going to be looking at some examples of stage 1, ascertaining whether the casualty can self-extricate.
Hi there.
Hi.
Hi, I'm James, one of the paramedics of the ambulance service. What can I call you?
Peter.
Peter. Morning, Peter. Listen, Peter, maybe a silly question, but how are you getting on?
I'd like to get out.
You'd like to get out. Perfect. We'd love to get you out of here too. And actually, do you know, one of the best ways to get you out of here safely and comfortably is to actually invite you to step out. Does that make sense?
Yes.
Great.
Yeah.
Well, listen, there's a couple of things I just want to check first. Can I get you to move your arms and legs as best you can?
Yeah, arms feel okay and my legs feel okay.
Excellent, that's great news. So look, we've opened the door as wide as we can. We've made this as safe as possible for you. The ambulance stretcher's just over here. So why don't I invite you to step out when you're ready, and we'll make our way across.
Oh, thanks.
Brilliant.
Thank you.
Okay, so that's a great example of a self-extrication being performed by an experienced clinician, in this case James, who's really used to assessing patients. But what about those non-clinical responders? Well, as we mentioned earlier, the You Step Out aid memoir can be really useful if you don't do this every day as part of your job. Now let's have a look at that being used in practice.
Hiya sir, my name's Cameron from the fire service. Can I get your name please?
Yeah, I'm Peter.
Peter, nice to meet you. Shame about the circumstance. I can see you've been in a bit of an accident today, so why I'm here is I want to get you out of this car as quickly and as safely as possible.
Great.
Okay? What I want you to do for me first is, are you able to move your arms and legs? And does that feel nice and comfortable?
Yeah, it feels okay, thank you.
Yeah, great. So I've made a nice big open space by opening the door here. What I want you to do now is try and get yourself out of the car and we can get you checked over by the ambulance. Does that sound good?
That sounds great.
Yeah,
thanks.
great, Peter. If you could do that for me.
Thank you. Thank you.
Good stuff. Cheers.
Excellent. So you could see Cameron from the fire service using that You Step Out aid memoir to structure his self-extrication of that casualty. But of course, it's not always that straightforward, is it? So let's have a look at another scenario where the patient can't self-extricate.
Good morning, sir. My name's Cameron from the fire service. What can I call you?
Hi, Cameron. I'm Peter.
Peter, nice to meet you. Shame about the circumstance. I can see you've been in a bit of an accident here today. What I'm here to do is try and get you out as quickly and as safely as possible and as comfortably as well. What I want you to do for me is, are you able to move your arms and legs for me?
I can move my arms. It's just too painful. It's just too painful.
Painful in your legs?
Can't move.
Okay, not to worry. What I want you to do is sit tight. I'm going to go and get some more help and take some nice deep breaths for me as well, okay?
Thank you.
I'll be back in a sec.
Thanks.
Okay, so here we've got a patient who is unable to self-extricate because they are in too much pain, and that is absolutely okay. So for this patient, if the vehicle is safe, it is absolutely appropriate to provide some pain relief initially, and that might then facilitate self-extrication once that's been given. So pain relief, absolutely fine, and this is not about making patients suffer. Next up though, what about when the door you want to self-extricate through is obstructed?
Hiya, I'm Simon. I'm one of the paramedics. What's your name?
Hi, I'm Peter.
Hi, Peter. Sorry about this. Want to get you out as quickly and safely as we can. Just to check, can you move your arms and your legs?
Yeah, I can move arms and legs.
Great. Okay. I'm just going to go and have a chat with the fire service about how we get you out with that car in the way right there. Probably the easiest way is for you to step out. We just need to create the space to do that. So I'll be back with you in a moment.
Okay, thanks.
Aaron, it looks like Peter can move his arms and legs. Looks like he'd be able to self-extricate and we could use the You Step Out. Clearly we've got a bit of a problem there with the way that the cars are. I don't know what you think the best way will be to get him out.
I think the easiest thing to do, Simon, is we'll just relocate this vehicle. We can move it back out of the way. We can get it done in a minute or so. If you're happy, we'll do that.
Sounds great.
Yep, okay. So casualties, driver, he can step out. Spoken to medical, they're happy, so we'll assist with that. What we need to do is relocate this vehicle. So let's get a steering wheel cover on, and then when you've done that and we're happy, we'll move the vehicle back, open the front seat driver's door there, and we can get him out with assistance of ambulance, okay? Okay.
Okay.
Handbrake on.
Brake on. All right, we've got a bit of space now, and I think you can step out. Do you want to have a go?
Thanks. I'm struggling a bit. Can you give me a hand?
Yeah.
Thanks.
All right, we'll just head over here.
So vehicle relocation to facilitate that self-extrication there. Really good liaising between the different services on scene with clear communication around the ability to self-extricate and of course use that step out. And again, a really excellent briefing on the priorities and the immediate objectives by the fire incident commander. Now the last bit at the end of that video also introduces the idea of something called minimally assisted self-extrication, and in this case it was no more than an arm being offered to help that casualty get up from the seat. Let's have a look at another example of minimally assisted self-extrication.
Hi, Pete. We've got a bit of space now. Do you want to have a go at getting out?
This is hard. Can you give me a hand?
Yeah. Hold on. Let me grab just bullet. Hold on 1 sec. That's it. Okay.
Thanks. Thanks.
So in this case, the minimal assistance involved an arm, but also some gentle assistance to stand by holding the back of the trousers or the belt. So really simple, really easy, and crucially really quick to help these patients exit the vehicle. More on that in just a second, back in the studio. Excellent, chaps. Well, here we are again. So that's stage 1 of the extrication decision tool, I think, as we're going to go through all of the 3 stages now. But I mean, I thought that was, a really nice representation of how you're going to do that and implement it in practice. But I'm sure there will be people out there who want to know a bit more. And I've certainly got some points that I've written down that I think need just that little bit more clarification, because it's that difference that could stop someone doing a U-step out approach versus enabling them to do it. So the first thing for me is just going back to the video we've just seen, so video 3 in that section. We talked a little bit, or you saw demonstrated something called minimally assisted extrication. Slightly ambiguous term. So tell me, what's that mean to you? What's minimally assisted versus assisted extrication?
Yeah, so I think what we're trying to do here, isn't it, is we're trying to empower the patient to be able to get out of the car. We're only really going to be able to find that out once they actually do start to get out. And we're all humans at the end of the day. We don't want to see someone suffer trying to get out of the car, but also we don't want to sort of jerk, yank, provide sudden forces that they don't need to have sort of exerted on them. So I think what we saw there was that we're providing some gentle support in order for that patient then to self-extricate, but we're not trying to provide really significant forces when we don't think that's going to be in the benefit of that patient.
Just to jump on that slightly, if I was getting out of a really low sports car, I mean, I'm thinking of myself as being reasonably fit.
Have you tried that before, Rob?
I haven't got Simon's sports car, obviously. But, a little helping hand to get up from that on a good day would be welcome, let alone following a road traffic collision, So that's sort of in my mind. What do you think, James?
Yeah, no, I totally agree. We're not dragging the patient out of the car here, are we? This is a patient-initiated active process from the patient that we are just assisting. So, the patient has to be able to get themselves out of the car, but they just require, they can do 95%. We just need a little 5% of support to them. And I think support's probably the key, isn't it? We're not actively doing anything to the patient. We're supporting their own activity.
Yeah, and we don't need to be really worried about the fact that we are putting a hand on to give them a handout with that assistance, do we? That's absolutely not what we're trying to encourage here. This is about not massive forces, but, really supporting them self-extricate from the car.
We talked a lot about historical practice so far on this course. One of the things I think people might be a bit surprised to not see is the collar. Because that was, really well embedded into practice, admittedly maybe a few years ago, and it started to maybe sort of fade out slightly in some areas, but it definitely still has that sort of resounding level of concern in our head when we don't see a collar. So what's going on there? Because I know on your presentation in the course, Rob, you talked about the fact that it did seem like collars helped. Help me out with this. Where do they come in?
Essentially, there is good evidence that collars reduce movement. Okay, simple as that. But the clinical importance of that movement, as in what it actually means in the long term, isn't really understood very well at the moment. We haven't got high quality evidence that says that putting a collar on someone prevents them having further injuries. It doesn't work like that. What we can say from our studies is it does appear to reduce movement, but there's different types of movement, which is when it gets more complicated. So you've got this idea that at one point you might move a long way, But then at another point, you might move a really small way, but you might do that repetitively. So there's this cumulative movement versus absolute 1 point movement. So collars in context do reduce movement, but what that actually means, no one really knows. Now, what I think the absolute thing to say is that if you were to apply a collar, I don't think that's wrong whatsoever, but we apply it for the extrication phase. So it's to help them get out of the vehicle, and that can be self-ex out of the vehicle, not a problem whatsoever. Now, what happens after that? Well, if you, in your normal practice, would take it off to avoid some of the negative effects of collars, which are well documented, absolutely fine as well. So I think the use of a collar at the point of extrication, if you want to do that, no problems. But what it doesn't mean is that we revert back to mid-2000s. We keep that patient absolutely still. If you're putting it on, it's to aid them to exit the vehicle in the most appropriate method. What it doesn't say is, okay, stick that collar on and now we can all relax and take 30 minutes to take the roof off the car. Because that's what I think in my mind it's associated with. Collars are associated with going slowly and deconstructing a car. And that's not fair, I don't think, on the collar, to be honest with you. It does reduce movement, but equally, do I think that it would be required in everyone? No, I don't think it's required in everyone at all, because I think an awake person who's completely orientated, I think muscle spasm is really, really effective at keeping that neck still, and then being out of the vehicle and having any other injuries, that's the important bit for me. So collars, yay or nay, is absolutely fine in that extrication phase for me. You follow your local institutions, and hopefully the guidelines will align a little bit better as we get more evidence in the future.
Yeah, and it isn't just being lazy, not wanting to put a collar on, is it? It's that the actual act of putting a collar on is quite fiddly with someone who is trapped in a car. Yeah, absolutely. Yeah, so it's a risk benefit analysis, isn't it?
I guess we've done that stage 1 of that extrication decision tool. Let's get on to stage 2, looking at whether a snatch rescue might be indicated.